Now that you understand how carbon monoxide toxicity occurs, in this MedMastery lesson, we'll cover the importance of oxygenation when treating your patients. So let's figure out what happened to our patients from the previous lesson. To recap, they both complained of headaches and dizziness after fainting at home. And the clinician suspects carbon monoxide toxicity. Looking at our ABC roadmap, any patient with neurological symptoms is at risk for aspiration, so make sure you protect their airway. But carbon monoxide toxicity mainly affects breathing and circulation, so we'll focus on those. If your patient has severe toxicity, for example, if they faint, feel dizzy, or lose consciousness, then you should also check their blood sugar. And get an electrocardiogram because patients may suffer a heart attack or heart failure as a result of severe toxicity. It's important to know that a pulse oximeter will actually show a normal oxygen saturation between 95 and 100%, even though carbon monoxide blocks oxygen's ability to bind to hemoglobin. This is because the oximeter can't discriminate between hemoglobin that is saturated with oxygen or carbon monoxide. There is a similar device called a co-oximeter that can specifically detect carbon monoxide. But the most reliable way to determine the severity of toxicity is by checking the blood level of carboxyhemoglobin, which can be obtained from an arterial blood gas sample. We're all exposed to carbon monoxide in the environment, so most people will have low levels of carboxyhemoglobin, but they should be less than 3%. Cigarette smokers can have levels of up to 10% or even more, so make sure you get this information from the patient to help correctly interpret the lab value. Because the organs may be starved for oxygen, using a face mask that supplies 100% oxygen at the fastest possible rate is a good place to start. Increasing the amount of oxygen circulating in the bloodstream will help remove some of those carbon monoxide molecules from hemoglobin. If you recall our wartime analogy, we left off with our soldiers being held hostage by enemy troops. Now imagine that reinforcements arrive, representing additional oxygen, to rescue our soldiers. Our army starts to outnumber the enemy, who is ultimately forced to retreat. Here's why giving oxygen, despite a normal oxygen saturation level, is so important. If the patient continues to breathe room air, which contains 21% oxygen, it would take about 6 hours for the amount of carbon monoxide in their blood to decrease by half. This is known as the half-life. By giving 100% oxygen, it speeds this process up and decreases the half-life to about 1 hour. Moving on to the circulation. Most patients will have normal vital signs. But as we discussed before, those with severe toxicity may experience heart failure and low blood pressure. So it's a good idea to start intravenous fluids as the first step in supporting the patient's circulation. An arterial blood gas test is helpful to determine the severity of illness, and this often includes the carboxyhemoglobin level. We tend to see a low pH, low bicarbonate, and interestingly, normal oxygen levels. This is because this value does not represent oxygen bound to hemoglobin, but rather the oxygen that is dissolved in blood. So even though less oxygen is bound to hemoglobin, it doesn't affect this value. For patients with severe toxicity, hyperbaric oxygen is a life-saving treatment. This involves placing the patient into a sealed chamber that provides oxygen at a higher pressure than that in room air. This further decreases the half-life of carbon monoxide to 20 to 30 minutes. So when should you consider hyperbaric oxygen? Well, if the patient has an abnormal neurological exam, loss of consciousness, signs of cardiovascular dysfunction, such as an abnormal electrocardiogram, a carboxyhemoglobin level of greater than 25%, or if the patient is pregnant beyond 24 weeks, the risk of death, including loss of the fetus, is significantly higher, and hyperbaric oxygen therapy should be offered. Additionally, patients who do not improve with standard oxygen therapy, either by reduction in symptoms or their carboxyhemoglobin level, are candidates for hyperbaric oxygen therapy. There are chambers located throughout the world, but this might require transporting the patient a long distance to get to one. And there are websites with a list of chambers, but you can also contact your regional poison information center or toxicology consultant for assistance. Because both of our patients had lost consciousness, they were transported to the nearest hyperbaric chamber. Once they finished their treatment, their symptoms completely resolved.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how MedMastery can help you become a great clinician, make sure to watch the About MedMastery video. So thanks for watching, and I hope to see you again soon.